Hi, so my name is Dr. Wahbi El-Bouri. I'm an associate professor at the University of Liverpool, where I work on developing digital twins and in silico trials. And my role in this project is I head up Work Package 6, which is a work package dedicated to developing in silico trials. And what that means effectively is running clinical trials on a computer. I decided to join the project because the goal of the project, which is to see whether we can improve the health of people with atrial fibrillation, using technology, is something that I thought aligned really well with my passion. And I know people who are affected by atrial fibrillation and the condition and the negative condition it can cause for individuals. So I decided to join the project to see whether we can improve the health of these individuals. I'd say the most exciting part of my job is working on these really new technologies and seeing how we can apply these to healthcare. All these, you've heard of AI and these computational models, and it's a field that's really rapidly growing. And I think for me, that's the most exciting part, is how do we apply these technologies to help people who have poor health. So the Aristoteles project, I think, is really unique in the sense that we are running clinical trials across 4 different countries to test this AI technology to prove it works and is better than the current standard of care in hospitals. Now, most AI technology is not tested in this fashion, and what we're doing is testing it on a really large scale. And not just that, in my work package, we're testing it computationally to kind of look at outcomes 5 years down the line, not just 1 year down the line. And for me, this is the real novelty and the real draw of Aristoteles. In my field in the next 10 years, my hope is we will see AI technologies and computer technologies being used in hospitals. We're doing a lot of research on it right now, but what I want to see in the next 10 years is that it is being used directly to treat individuals, improve their health, and prevent them from getting further diseases down the line, to give them long, healthier lives. I decided to join Aristoteles because I know a lot of people who are affected by atrial fibrillation, and the burden of the disease on them is quite high. It causes a lot of difficulty in their day-to-day life. And this project is trying to use technology, use AI, and use these in silico trials to effectively improve their life and improve comorbidities further down the line. So for me, that's the really exciting thing, and that's why I really wanted to be a part of it. Will AI revolutionize the medical field? I think yes, I think it will revolutionize the medical field. We've already seen it revolutionize our day-to-day lives in many ways with these technologies such as ChatGPT, with these image generation and video generation technologies. And we're not that far away from using it to help individuals. And it's already being actively explored in very large companies, on how we can use AI to treat, monitor, and prevent disease. So yes, I think it will revolutionize the healthcare field, and probably sooner rather than later.